Maggie's a good friend.
I love you. I'm going to be there with you. Let's do it.
I'm ready.
People across the U.S. are being inspired to check on their own health after actress Olivia Munn revealed yesterday that she was diagnosed with breast cancer last year.
This is a sobering report. Munn says she had 4 surgeries in the past 10 months, and that includes a double mastectomy. 43-year-old says she was diagnosed 2 months after testing negative for 90 different cancer genes. Munn said she also had a normal mammogram around the same time. According to Munn, her cancer would not have been found until her next scheduled mammogram the following year. That's if her doctor had not decided to conduct a risk assessment for breast cancer. Now, because of this, Munn learned her lifetime risk for the cancer was 37% and got a biopsy.
Dr. Neil M. Iyengar is here to offer his medical expertise on the subject that really just has everyone talking today. He is a breast oncologist for the Memorial Sloan Kettering Cancer Center. It's great to have you with us here. So first of all, let's just start with the most basic of questions. How could Munn have tested negative for cancer genes, had a normal mammogram just right before learning that she actually had breast cancer?
Well, thank you for having me. And I am so grateful to Olivia Munn for using her platform to bring awareness to this topic, to this very important topic. To address your question, we have to remember that the majority of breast cancers are not actually caused by a genetic mutation. The majority of breast cancers are either, unfortunately, random or caused by other risk factors. So this is why it's important to use other risk screening tools like a family history, like a history of a personal breast disease, as well as lifestyle factors to determine if somebody should have escalated testing for breast cancer screening.
Look, this is something that touches everyone. You're either a woman or someone you care about a woman in your life. Fortunately, Munn's doctor decided to conduct this risk assessment for breast cancer. Explain what that is exactly and how race and ethnicity can factor into that.
So the breast cancer risk assessment tool is actually a tool we've had for quite some time. It's otherwise known as the Gale model. And this is a series of questions that your doctor can ask you, or you can actually go online and take the test yourself. It's very short. It assesses your race, ethnicity, your family history, your reproductive history, like when you started your menses, how many times you've been pregnant or the first time you were pregnant, and factors all of these in to produce a percentage risk score for developing breast cancer in the next 5 years and lifetime risk.
And as we're talking about how Munn is using her platform to destigmatize breast cancer, it's also worth noting, of course, that men can also get breast cancer, even though women are disproportionately affected. But let's continue to dig deeper into this, because after this risk assessment, which I knew nothing about before this, I took the Gale test this morning. Munn then got an MRI. She then got an ultrasound. Then I understand she got a biopsy, which all of that feels like a lot when all the indications, according to most people, is you're all right. But that showed that she had breast cancer. How accessible are these options to people who are not celebrities? How concerned should other people be? Because most people out there who are listening to this aren't going to have the kind of doctor that walks you into surgery and says, "I love you," as we saw in that soundbite, and does all of these tests. So how do we empower our viewers and all of the folks out there who might be concerned?
Such an important question. I think the first thing to say is that the breast cancer risk assessment tool is something that all women should be thinking about or asking about, women ages 35 and older. And it's really a series of questions that's pretty simple to administer by the doctor. Now, all of those other tests that you mentioned, like the MRI, the ultrasound, the biopsy, and so forth, the issue with those tests is that those are highly sensitive tests. But if you are a person who has a lower risk for developing breast cancer, those tests can actually be somewhat harmful and lead to unnecessary biopsies, anxiety, and so forth. So we really reserve a test like a breast MRI for people that are higher risk, either because they have a genetic mutation, a family history, or the risk assessment tool predicts a higher risk of developing breast cancer.
Really quickly, should insurance change on this? Should more of the type of testing happen, especially when we're talking about women of color disproportionately have denser breasts that are not picked up on mammograms, for example?
Yeah, I certainly think that a lot of these tests should be much more accessible. Certainly genetic testing should be much more accessible to everyone. I do think that we need some caution in terms of what types of imaging a person undergoes for the reasons that I just mentioned. But this is an important accessibility issue.
All right, Dr. Neil Iyengar, thank you.
Thank you.